Hi, I'm Sarah Jo Best, Public Health Director for Lincoln Trail District Health Department. As of 4 p.m. on May 12th, there are a total of 139 cases of COVID-19 within the Lincoln Trail District. The total number of cases per county are as follows: Hardin 63, LaRue 6, Marion 17, Meade 17, Nelson 31, and Washington 5. Currently, 128 cases are on home isolation or have been released from monitoring. County-level case information can be found on our webpage at ltdhd.org. While much of the COVID-19 coverage has focused on its rising death toll, the overwhelmingly majority of those who contract the disease ultimately recover from it. Individual experiences have varied widely, from no symptoms at all to stays in the ICU. As of 5/12/2020, there were 2,546 Kentuckians who had recovered from COVID-19. During this week's community update, I will be sharing a story of one of our patients who consented to answer a series of questions about her battle with COVID-19. She is a 33-year-old female from Bardstown. I would like to publicly thank her for her willingness to share and provide another perspective on COVID-19. The following is her story in her own words. She begins by telling us what she felt her chances were of becoming infected with COVID-19. Truthfully, I knew it was a very real possibility. I work as a physician assistant in an urgent care center in Louisville, and I knew my exposure risk was high. Even though I am diligent about PPE and hand washing, that said, I did not think I would become infected as soon as I did, or that my course would be what it has been. In my case, I was completely asymptomatic until I wasn't. On April 2nd, about 2 a.m., I woke up with the terrible chills and a severe headache. I checked my temperature and it was 100.6. I felt nauseous and dizzy and just ill. Because I had worked about 4 days before, I was obviously concerned about COVID. It is protocol at my company to notify employee health as soon as possible if you develop any concerning symptoms, which is what I did. I had a telehealth visit later that morning and was tested via drive-through site that afternoon. Since I work in healthcare, my telehealth experience in getting tested was definitely different than most. It was a very quick and easy process, especially at that time, which was not the norm. At my telehealth visit, the provider advised me that I did likely have COVID and to go ahead and start self-isolating until the test results were back. Unfortunately, by this time, I had already been around my family, which included my husband and our 2 children, none of whom had started showing symptoms yet. The doctor said the whole family should self-isolate until you know for sure. But you're young, non-smoking, and otherwise healthy, so I'm sure you'll be fine. Just in case, she told me to watch out for any signs of worsening respiratory distress and go directly to the hospital should any concerning symptoms develop. My results came back less than 72 hours later. I was positive for COVID-19. Again, I was told that my family and I needed to self-isolate, which we were already doing, and that I could be retested 7 days after my last known fever. I would not be allowed to return to work until I had 2 consecutive negative tests at least 24 hours apart. After the initial onset, those first symptoms persisted for the next few days. The severe headache was the most predominant, but it was bad but not debilitating. Low-grade fever was also present for about 5 days, but I took Tylenol every 8 hours and that helped. I did later develop a cough on about day 3. Mostly it was dry, hacking, with some wheezing, but I never had any shortness of breath or trouble breathing. Also, on about day 4, I lost my sense of taste and smell. That was something I've never experienced. Both were completely absent. The only thing I could register was saltiness. Hot liquids seemed to help as much as anything, so for days I lived on black tea and chicken broth dosed with soy sauce. Senses did return about after a week. I never had any major body aches or muscle soreness, but the decreased energy and the excessive fatigue lasted for about 8 days. Unfortunately, shortly after my test results came back, the rest of my family started showing symptoms as well. First my husband, and then my kids. We were all tested and all were positive. I have a 4-year-old daughter and a 2-year-old son. Thankfully, the kids' course was mild and short-lived. Fever, cough, sore throat, runny nose, a little lethargic, but overall nothing lasting longer than about 4 days. My husband's course was much like my own, except for the loss of taste and smell. 5 weeks later, he has still not come back. Every morning he pops a jelly bean to do a taste test, but is still lacking as of today. My course lasted about 9 days total. I have been mostly asymptomatic this past month. Interestingly and unbelievably, I am still testing positive. To date, I have had 9 COVID-19 swabs. Again, this is required because of my work, and all have been positive except the last, which is still pending. For anyone in our community who is not taking COVID seriously, who thinks it's no big deal, or that Kentucky's response has been excessive, I would say that you are very wrong. It is true my family had no major complications from the virus. It did not require hospitalization, but it still took its toll. It was scary and awful, and though we are over the worst of it, I'm still fearful of any long-term issues that this may cause for us in our future. So do your part. Social distancing is still important. Wear a mask in public areas and practice good hygiene. It's getting old, I know, but the numbers of those infected are still going up, and so it is worth it. Lastly, I would say that we are so lucky to have great families, friends, and neighbors who have and they're still supporting us in our quarantine, bringing us food, schoolwork, and lots of other little necessities. We are so thankful for them and could not have made it through this without their love and support. I would like to end by echoing the words of our patient. We are battling a virus we learned about only 5 months ago. We know about COVID-19, and we know that it changes weekly. Therefore, it is still important that we continue to practice preventative measures to reduce the spread of COVID-19. Thank you.